Hello, everyone. Welcome to the It Hurts to Moan podcast. I'm Lauren Rose, and today we're talking about Ayurvedic medicine. Today's guest is Meghna Mistry, a pharmacist and Ayurvedic consultant in London. Welcome, Meghna. Thank you for coming on.
Hi, thanks for having me.
So tell us a little bit about yourself first.
So thanks for the introduction. So my name's Meghna. I'm a pharmacist by background. So I've been working as a pharmacist for about over nearly 10 years. And I've just loved science and I loved working with people. So that's how I started my career in pharmacy. However, throughout working as a pharmacist, I realized that I feel like there's always something missing, like especially the prevention side of things. Like you get loads of patients that come in, but I feel like you can only really treat them once they've been diagnosed with something. And I maybe see like patients coming in quite frequently, and it's not very rewarding as a job because you see them again and you're like, oh no, like what's happened now? Because I used to work in a hospital, so seeing patients not improving sometimes was a bit unsatisfying. So I came across Ayurveda actually. Firstly, it's with an Indian background. I was familiar with a few Ayurvedic principles. So, like for example, when I was a kid, my grandma or mum will always tell me to maybe have turmeric if I'm not well. And these are like Ayurvedic principles. So throughout my career, as I got more interested in the prevention side of things, I wanted to seek further into what else can be done to help patients improve their wellness and not just be disease free, but actually live a healthy, happy life. And that's when I came across Ayurveda. So one of my friends actually had IBS and she got treated through Ayurveda. So she was no longer on her medicine and her condition improved drastically. So with my scientific background, I was like, oh, I want to know more about this. So yeah, that's really where my Ayurvedic journey started. So about 3 years ago, I started studying Ayurveda. So I came across a course in London that was about 2.5 years. And I felt like it was a whole new world. Like it was really interesting. There was so much to learn. And yeah, it was just looking at prevention and a holistic health, which was really exciting. So it's looking at things like how we can prevent disease in the first place, how one disease is linked to another, and also how everybody is so different and what may work for one might not work for everyone. And I know in Western medicine, it tends to be like, you're either on steroids or antibiotics, and it's just quite generic. They don't actually look into individuals and try and tailor the medicine accordingly. So yeah, that's a bit about me. And yeah, I feel like I've not looked back since I've started doing Ayurveda. It's always there's always so much to learn and it's always really, really interesting.
Yeah, I'm a big fan of holistic medicine, especially the last few years, just as I struggle with my own health and chronic pain complications, and Western medicine isn't doing much. They're trying to put a Band-Aid over the symptoms, but not actually, prevent future, migraines or future pain, and certainly not get to the root of the problem. So I'm interested in learning some more. So what exactly is Ayurvedic or Ayurvedic? I'm not sure how to say it, medicine, and just give us some more information about that.
Yeah, sure. And yeah, I love what you said actually, because getting to the root cause is really important, and that's what Ayurveda is all about. So Ayurveda is basically a form of medicine that originated in the East. It's quite old. It originated more than 5,000 years ago. Although it has ancient roots, a lot of the principles still apply today, and that's why it's still effective in this day and age. So it's actually one of probably the oldest healthcare system, and it's actually like a living science. So, and the word itself, so Ayurveda is split up into two words in Sanskrit. So Ayu means life and Veda means knowledge. So it basically translates to the science of life, the science of longevity. And it's very much about living in harmony with your own nature and those around you. So the nature around you. So for example, rising with the sun helps our circadian rhythm, and it's just good to realign with nature. Ayurveda basically teaches us about what we do and how it affects our health. So day-to-day things can affect our health, and I'll go into a bit more detail in that in a minute. So really, how does Ayurveda work? So it's all about balance. A big word that comes to mind when I think of Ayurveda is balance. It's like balancing, and that's why it can sometimes be difficult in a sense that it might not always be easy, but you know, it's interesting. um, so yeah, and it's like a science that's more based on prevention rather than cure. Um, yeah. Do you want me to go into detail of how it works now?
Yeah, that'd be great.
Okay,
I'm really
yeah.
curious.
Okay, so the fundamental thing in Ayurveda is that there's an understanding that there's five elements in the universe, and that's air, ether, fire, water, and earth. And ether is space. So the whole universe is made up of these five elements, and as we are part of the universe, we also have these five elements within us. So, and these five elements combine to make doshas, which are different energy types. So, for example, Vata is one of the doshas, and that is made up of air and ether. Pitta is another dosha, and that's made up of fire and water. And Kapha is the last dosha, which is made up of earth and water. So these are basically energy within our bodies and our minds. And Vata is basically like, think of Vata as wind, think of Pitta as fire, and then Kapha, think of it as like earth and like structure. So everyone has all three doshas within them. They might have different proportions. So I might be more Vata, whereas someone else might be more Pitta. And what this means is these doshas are responsible for all the functions within our body. So, for example, Vata is governs anything to do with movement. So, for example, the blinking of our eyelids, the pulsation of our heart, and even like our thoughts circling around in our head. That is a sign of Vata. Even like our blood flowing throughout our body, that's what Vata is responsible for. Pitta, on the other hand, is responsible for anything to do with like transformation. So this could be digestion of food. It could even be digestion of thoughts, or metabolism, anything that's kind of changing from one to another. That's kind of where Pitta is important. And Kapha is Kapha is like our physical structure, and it's our physical body, and it also gives us stability. So those are kind of the three doshas. And like I said earlier, we all have a certain amount within us. And during our lifetime, one or more of these might be out of balance. So, for example, when we're kids, during like, when we're born up until like maybe puberty, at that stage, we are growing. So that's when Kapha is more dominant. Whereas when we're in adulthood, we're maybe at the peak of our lives, we're driven in terms of our career and, wanting to succeed, that's where Pitta is the strongest. And then as we maybe get past adulthood and, going towards the elderly side of things, that's where Vata comes in. And, we're slowing down and, yeah, just taking a step back, perhaps. So in these different stages of life, as well as the stage of life and also the food we eat, the lifestyle we live, these kind of things can have an effect on our doshas. So say we're born with a specific constitution. Throughout our life, our constitution changes. So for example, we might have more pitta in our body at a certain time. And this, sometimes we can be okay with having a lot of pitta, but sometimes when it gets a little bit too high, that's when we might start to see signs and symptoms within our body, within our mind, and that's what leads to diseases. So, for example, I had acne a few years ago, and I was in a stressful job. I was doing lots of exercise. I was probably eating lots of spicy food, and all these three things. And I was also in the pitta stage of life. So there's probably four factors involved here, which are all related to pitta, which is the fire element. So with too much fire in my body, up until a certain point, my body's okay, but then it gets to a point where it's starting to show on my skin, for example. So that's just a brief example. in terms of the other doshas, so if you've got a vata imbalance, you're likely to have bloating, constipation, you might be dehydrated, anxiety is common in vata people or vata imbalances. Pitta imbalances, so like I said earlier, you could get acne, you could also get heartburn or ulcers, and you could also mentally, you could feel like angry, agitated. Those are kind of the pitta emotions. And then lastly, kapha imbalance. So someone with a kapha imbalance might have weight gain, they might frequently get colds and coughs, or they may even have depression. So yeah, it's quite interesting to break down the three different doshas and how each one can be responsible for a certain condition. Just to complicate things further, you could have two doshas that are out of balance. So maybe you've got vata and pitta, and that could obviously cause more problems. And that's why it's just getting that fine balance right to help your condition really. So the other bit I wanted to say is in terms of the treatment, we would try and give something to balance the imbalance. So for example, if someone's got a vata imbalance, vata is related, so all of these three doshas are related to different qualities. So if you break down the doshas further, you have about 7 qualities for each dosha. So as an example, vata is cold, dry, rough. So in terms of like food, for example, if you're eating loads of cold food or dry food or rough food, even like crisps, nuts and seeds, or drinking loads of cold water, these things might put the vata out of balance even more. So the goal really is to treat the qualities with the opposite qualities. So for example, if with the coldness, you might give something warm instead. So it's better to have warm drinks, warm food, avoid raw vegetables. You should have cooked vegetables. So things like that help to balance the imbalance. And then, for example, pitta imbalance, if someone's got a lot of pitta, they might have a lot of heat in their body. So for them, something like coconut water would be good because that's cooling for the body. So yeah, that's mainly the way we do the treatment. And in terms of that's the food side of things, but also exercise. So there's certain exercises that might aggravate your pitta. So someone that's got a pitta imbalance, it might be best to avoid vigorous exercise because that's going to increase your pitta. So something like light walking in nature, that might be recommended for the pitta imbalance. So yeah, I hope that helps explain it.
Yeah, I'm just thinking, I think I might have a vata imbalance.
Yeah.
Maybe even a kapha imbalance. So
Yeah.
that's really interesting. I've never heard of any of those. So what are some of the advantages of this methodology?
Yeah. So I think the main advantage is that Ayurveda looks at the body as a whole. So if you were to go to a Western medicine doctor, you might be seen by a gastroenterologist for your stomach, your psychiatrist for like depression or anxiety. And it's like you tend to look at the organ or system alone, which I personally find a bit frustrating because if you go to, I don't know, if I've had issues with my eyes, I go to the ophthalmologist, but they don't know anything else about me. But what if something else is also causing my eye issues, for example? So the thing I love about Ayurveda is that it understands a person as a whole and it links everything together. So it understands how constipation and anxiety are linked because they're both to do with vata. So when you treat one of those, it automatically helps the other one as well because you're treating the vata imbalance rather than you're just treating the constipation. And like Western medicine, if someone's constipated, you would probably give them some laxatives to help them go to the toilet, but it's not getting rid of the root cause. That anxiety might still be there. Just because you're able to go to the toilet, you might still be anxious. Whereas I feel like with Ayurveda, it looks at the whole body and the mind as well. It's like your mind, body, and soul, they're all just connected. So that's one of the biggest advantages I would say for me. Another thing is that it understands an individual as unique. And that's why the treatment is personalized for everyone. Like I wouldn't be able to, if someone asked me like, oh, I've got acne, what do I do? I would need to look into is why do they have acne? Is it because of their pitta imbalance? Or sometimes kapha can also cause acne. So it like each condition could be further broken down into vata pitta kapha as well, so sometimes. So I think Ayurveda helps to treat individuals according to their signs and symptoms, not just a generic tablet for everyone, if that makes sense.
Hmm.
Um, and I guess this kind of relates to the first one, but it also understands how like your emotions is also linked to your any like physical disorders you might have. So yeah, I thought that was another benefit.
Hmm.
What else? I feel like there's loads, but nothing else is coming to mind right now. Um, but yeah, I think that's it.
Are there any disadvantages? Like, for instance, is it going to interfere with somebody's, maybe religious or spiritual beliefs? Are there other disadvantages?
Um, in terms of religious or spiritual beliefs, maybe so Ayurveda can be quite spiritual. So maybe if someone doesn't have spiritual beliefs, they might be put off by Ayurveda. Um, Ayurveda is not a it's not, it doesn't have its own religion or it's not associated with a particular religion. It does come from the East, but it's not associated with a religion. So in that sense, it shouldn't have any disadvantages. But a few disadvantages I can think of is it's not a quick fix. So some people might want
Mhm.
something quick, like obviously if you're in pain, you might need to take a painkiller. Um, so it kind of works over a period of time. So it might be that someone's taking Western medicines, but then once they improve their body and mind through Ayurveda, then they might be able to come off those Western medicines. But it's not something that would fix overnight. So sometimes that could be a disadvantage for people if they want something a bit quicker. Um, and also it does require consistency and it's pretty much like a change in lifestyle. So it can be quite tricky to motivate yourself to avoid certain foods or certain practices that might help you. It might be difficult to motivate yourself to do it. So that's why I feel like people only resort to Ayurveda when they're really struggling and
Mhm.
Western medicine has failed them. Otherwise, someone that's generally quite healthy, they might not feel the need to resort to Ayurveda. But personally, I remember when I had my first consultation with an Ayurvedic consultant, um, I actually went in there thinking there's nothing wrong with me. I just want to go because I'm learning it. I want to know what it's like
Mhm.
from a patient's point of view. But only when I came out of that consultation, I realized like, oh, actually, maybe I'm not as healthy as I thought I was just by the questions. And like when you reflect back on your life, like if I've ever been really tired or if my mind's all over the place, like although that's still healthy, I could eliminate those things and be even healthier. So there's
Mhm.
like the gap between, I feel like Western medicine puts healthy here, but Ayurveda might put it a bit higher. So there's that gap in between where you can still improve your health. Um, but yeah, sorry, going back to disadvantages. Um, it might feel a little bit restrictive if like certain foods are being cut, you're being advised to cut out certain foods. But I think once you're balanced and you're healthy, you can introduce those foods. So it might not be like a permanent thing, but that might be one disadvantage for someone that might struggle with that side of things. But that's why I like to coach people through the process so that they've kind of got someone to help them. Another thing is, okay, so being a Western a pharmacist in the Western world, throughout my uni and like education, I've always been taught that alternative treatments or alternative complementary medicine doesn't work. So even when I first went into Ayurveda, I was a bit worried, like I'm coming from pharmacy and I'm going into Ayurveda, like is that allowed? Like, am I going to be judged by other people in the medical field? So maybe Ayurveda might have quite a negative what's it called, like a negative
Like
view on it. Yeah,
reputation. Hmm.
yeah. But looking into it, and when I studied it and when I saw people that had been treated from it, that's when I get the assurance that yes, it does work. Like it might not be recognized by the Western world, or it might not be, there might not be like scientific papers on it or anything, but there's evidence that it works. So perhaps one of the disadvantages is that the lack of evidence behind it,
Mm.
because I feel like people might take it more seriously if there was more evidence behind it. But maybe that's just me coming from a Western medicine world. Like I'm sure there's loads of Ayurvedic professionals out there that know that it works and have people around them that also appreciate it. But yeah, that can be a bit in the middle sometimes. You don't know if people would go for it or people won't go for it. But as long as it shows results, I guess that's the main thing. And I guess on that note, one of the disadvantages is that there might be a lot of fake information
Mm.
out there, because especially in England, we don't have a recognized like medical degree or an Ayurvedic medicine degree. It's kind of like diplomas that they do. So in terms of like qualification and background, I know in the East, like in India, Sri Lanka, they have more education around Ayurveda. So it could be a lot more trustworthy. So basically, it's important to, if you're getting Ayurvedic information like online or anything, it's important to make sure you check the person's like qualifications, like, and they're not just researching on Google or something, because there's a lot more to it than just perhaps what people post online.
Right, that makes sense.
Yeah.
And, it's similar to a lot of other alternative treatments that, Western medicine is going to say doesn't work, but it's been around for a really long time. And there are plenty of people who have been, impacted positively by it. So there's plenty of evidence as far as just anecdotal evidence, stories go. I think just because, at least in America, big pharma kind of rules the country. They don't want to do scientific research on alternative
Yeah.
medicine because they're not going to make so much money.
Yeah, definitely. Yeah, I agree.
So this has been really interesting. I had never, heard about it until very recently. So where can we get more information about you and what you do and about Ayurveda?
Yeah, so I do love to share the wisdom of Ayurveda, and I help people benefit from it. Just really so people can be happier, healthier, and just like enjoying life really. So I do post on my Instagram page. So my business is called Bliss by Balance, so bliss.by.balance. Um, and yeah, that's where, if you want to reach out to me, you can follow me or send me a DM on Instagram. If anyone's interested, I do have a few PDFs that I've created. So one is about like a Ayurvedic oil massage, which is meant to be good for especially those with Vata imbalances. But I've got a free guide on how you can do that, and also I've got a free guide on the times of day. So according to Ayurveda, there's throughout the day, the day is broken up into Vata, Pitta, and Kapha times. So I've got a bit of advice on what we should be doing at those specific times of day. So I'll give you a quick example now that I've spoken about it. So between 12 and 2, and that's both midnight and noon, is Pitta time. So for example, in the afternoon, 12 to 2, is where our digestive fire is the highest. So our digestive fire is basically like our stomach. Ayurveda refers to it as Agni, but it's our digestive power. So during Pitta time, our digestive power is really strong. So therefore, we should be eating our heaviest meal at that time, because that's when our body is the most capable of digesting the food that we eat. If we eat when our digestive fire is weak, we could produce toxins in our body, because it's like a barbecue. If you're cooking food on a barbecue and the flame is weak, it's not going to cook properly, and that could be toxins. So yeah, I just forgot to mention that bit earlier, but Ayurveda believes that our digestive fire is the cause of most diseases. So when our digestive fire isn't working well, we get toxins that circulate throughout our body. So for example, in the acne situation, those toxins have gone to my skin, and that maybe too much fire in my body is causing the toxins in the skin because it's burning the food, and that goes to the skin, so that causes acne. So yeah, I've basically got a guide on what we should be doing at Vata time, Pitta time, and Kapha time to help us stay balanced. So yeah, I'm happy to share those with whoever wants them.
Okay, so we need to reach out to you to get those? Is that how
Yes,
that works?
yeah.
Okay.
Yeah. I don't
Okay.
have a website yet, unfortunately, but I will advertise when I do.
Okay, awesome. Well, thank you for coming on. This has been really interesting, new information for me.
Oh, thank you. I'm glad you found it useful, and I hope your audience did as well.
I hope so too. And make sure to subscribe to this podcast so you don't miss any health, parenting, or life advice. For my freebie, 30 ways to relieve pain without taking a pill, go to ithurtstomom.com/tips. If you have comments, suggestions, or want to be on this podcast, please email me at ithurtstomom@gmail.com. I wish you all a blessed and pain-free day. Bye.